Hospital settings na siya, and you will be guiding your patient in walking na siya. Okay, so you have to enter the room by knocking on the door, approach your patient, and then you have to introduce yourself. Okay, hi ma'am, hi sir, ako ni si Prince, imong caregiver karon. Kamusta man ka? Things like that. Okay, na rapport gamay. Okay, after explaining the procedure, what's next?
Explain.
Sorry. After introducing yourself, explain the
Procedure.
Okay? So you will talk to your client, no? Na, ma'am, nanay ko din karon, so that I'll be assisting you in fitting the axillary pressure. At the same time, probably walk siguro, teach how to walk. Okay? Next is,
Identify if you have the correct patient.
so how do you identify if you have the correct patient? Okay, you can ask their complete name and include the date of birth. Okay, kaya naman, there are some names na pare-pareha. Especially ka ng mga common na mga pangalan. John, Mark, sa mga pangalan niya, alias kayo. Okay? Or, if the patient cannot speak, no, or talk, then you can check their armband. Okay, armband, every time your patient is administered in the hospital, lagi na sila armband. Okay, then read if you have the correct patient and read their names. Okay, next is
Wash, perform, and washing.
you have to perform and washing. Next is
Prepare the necessary materials. Check for any
okay,
damages.
so prepare your axillary crutch and check if there's any damages. Next is
Let the patient stand straight. If the patient is unable to stand, simply subtract 16 inches from the height to determine the crutch length you need.
okay. So ask if the patient can stand straight, much better guys. Yeah, because it's easy for you to fit the crutches. Yeah, but if ever the patient cannot stand straight, nakahigda pa lang siya, i-prepare na ninyo daan ang height sa inyong kwan. By asking your patient, pila yung height, then subtract it to kwan. Or, not actually subtract na po yung uban na need ka i-add. Like, for example, mingon sila 5'5", but when you fit it with, magkuwang pa, 5'6" siguro bagay sa mo. Because some of them are wearing shoes or kanang tag-as kay inches ang heels ninyo ba. So, increase ang height ni patient. Gets you, so try to add a little more. Okay? Dili pwede mag-high heels sa naong ninyo mag-high. Next is
Place the top of the crutches under the axilla or armpit.
okay, so crutch pass. So let's just say she's my patient, no? So I ask her to stand up straight, so stand up straight. So when you say stand up straight, make sure that the patient is straight hiratin. Dili kay magingunan na siya magbarog kay because we cannot fit the axillary crutches properly. So ask the patient to stand up straight. Then before you put the crutch pad on her side, ask her pilay height mo. Pilay height mo ba? 5'4". 5'4". Okay, so you adjust that to ang axillary crutch to 5'4". Okay, so punta na to. Parehani. Look. Oh, okay. Because taas kayo ang shoes na yung so literally taas kayo yung shoes na yung so that's yeah. So let's go with pareho ko sa 5'6". Kenny, this is okay. Okay. No, by the way, forget, when you make an adjustment, but please do not put the crutch pad on the floor. Nakikibutang pili sa armpit ni patient. Kaya mas hindi magkahugaw ang armpit ni patient. Okay? So we put that on the sides. Okay. What's next?
Put the end 12 to centimeters.
Okay. Or how many inches?
5 to 8 inches.
5 to 8 inches away from the side of your patient. So 5 to 8 inches, then 5 to 8 inches is here, so that makabalance si patient is here. Next one is
The crutches are the correct length if there is a 2 to 3 finger space between the top of the crutch pad and the
Now you
armpit.
have to remember this one. Most of the time when we see somebody, patients who are using axillary crutch, kani crutch pad dapat na siya sa ilong, actually dili. Okay? There should be space between your armpit and your crutch pad, which means that the crutch pad is actually located at the side of our chest. Okay? But the question is, why is it that the provided of space, or why is it that the crutch pad is not directly on the armpit?
Para itilakaw din mo, sir, kaya madiretso na siya.
Diretso na siya.
There's a space.
For there will be space for movement. Pwede. Unsa pa?
Muscle strength.
Grip.
Dili
Ang
na
grip.
sakit ang ilong sa patient. Kaya
Okay.
sige ka,
Dili magsakit ang ilong
dili ka
ilong.
magka mo. Namang yung anak nga.
Armpit. Okay. So I'll rephrase your answer this year. Okay. Now you have to remember this one. Your armpit also has a major artery which supplies blood all throughout your upper extremities. Yeah. Gets ninyo? If mapiit na inyo ang ilong, mapiit po itong ugat. So what will happen? Less blood, mag-numb din yung gamot ni patient. So mag-reason din nun siya, oh, lakaw. Kaya naminon or nag-numb na yung gamot. Gets ninyo? This is the reason why ganun si crutch pad is on the side of the chest. Okay? Next.
The hand grip should be at rest level when your arm is hanging by your side.
Okay.
Your elbows are slightly bent as you push down on the hand grips.
Okay. So check na yun. Okay? So look, the hand grip is at the level of your wrist. Na siya. Okay? So sa biggest foot, the hand grip should be level of the wrist. Okay? Next. What's next?
Wala na, sir.
Sit down and stand up on chair.
Dito rin ko to.
Yes.
Okay? So that's how you properly fit the axillary crutch towards your patient. That's you. Then you use for patient who has weak legs. Okay? Although they can walk na siya, but the problem is that your patient can no longer walk kanang straight na siya or kanang hunat na siya because it's already weak na siya. When we say weak, like losing of muscles, natila na niya, which means that when a patient walks, they really need assistive devices. Another issue is poor coordination. Okay? Or dili balance ang ilang pagkakaw. Okay, so when they walk, most na bubog pagkakaw. Lumuro pa, patakili ito, nakapadong na dito. So to prevent this, na ma-accidente ang inyong patient, then they will be using axillary crutches. So let's start off with the 4-point crutch gait. 4-point crutch gait is the first crutch gait na matulog ni patient if bago pa siya nagsugod ng gamit sa axillary crutch. And both legs is okay ra. Weak leg, that's the problem. Okay? So how does a patient walk using 4-point crutch? Can you read?
Forward the left crutch or opposite crutch of the injured affected leg.
Okay? And then?
Forward the injured affected leg.
Okay, and then?
Forward the right crutch or opposite crutch of the good and affected leg.
Okay, and then?
Repeat.
Repeat.
Yeah, walking pattern.
Okay. So, during the assessment, okay, pa-perform mo how to walk using the axillary crutch and using the walking pattern. If the assessor will tell you 4-point, or even in reality, no, if you're already working in a hospital, if naka-remember mo na 4-point ba ang gamitin na walking pattern with patient, just remember the number 4, meaning 4 ka moves ang button. 4-point crutch gait. So, how does a patient walk using kanang 4-point crutch gait? Let's just say my right foot is injured na siya, or it's the weakest than the left side na siya. Okay? So, when the patient walks using axillary crutch, first is I'm going to forward the left crutch. And then next is my right foot or the injured leg, the bad leg na siya, the weak leg na siya. Then next is the right crutch, and then the left foot na siya. Gets niyo? Okay. So tanaw ha, tanaw, okay? So 1, 2, 3, 4. Okay, tagsa-tagsaon ninyo. 1, 2, 3, 4. 4-point crutch gait. Left crutch, right foot, right crutch, and left foot na siya. Gets ninyo? Ayaw ninyo lisod-lisura yung kong galingon. Nga naman, during the assess,
ahead siya.
pwede na po na ahead, depending on how the patient walks. Basta mo gini ang first walking pattern niya. Okay. So, you have to remember this one. During the assessment, mapaw ginang estudyante paglibog yung what's the problem? Because of how they learn the walking pattern, medyo lisod kayo pagsabot nila. Okay? Di man lang yun. 4 point, 1, 2, 3, 4, 1, 2, 3, 4. Isud nila sa mind. 1, 2, 3, 4. Because when I walk, 1, 2, 3, 4. 1, 2, 3, 4. Left crutch, right foot, right crutch, left foot. Gets ninyo? That's how they walk using a 4-point crutch gait. Okay? Now, the problem, the advantage of a patient walking using a 4-point is stable siya. Okay? And a balance kayo si patient when they walk using 4-point. The problem is, the disadvantage is, it's very slow. Okay? Hinay kayo mulakaw si patient using 4-point. Imagine na maglakaw sila. 1, 2, 3, 4. 1, 2, 3, 4. Imagine na kung Kasi tawag na, gihunong ka niya sa Gmall, i-muskulahan na rin din, maglakala ka mag 4-point. Nag-lunch na lang eh, huwag ka mabot yung Jollibee. Na-out na lang eh, pagsaka pa ni mo sa building. That is the disadvantage again of using 4-point. Okay? But when the patient already is familiar walking using axillary crutch na siya, then they will move to 2-point crutch gait na ngayon. That's new. So the 2-point crutch gait is the same as 4-point, but duha ka moves ra ang inyong water. Okay? Can you read the procedures for 2-point crutch gait?
Forward the left crutch and right foot together or injured affected leg and opposite crutch together. Forward the right crutch and left foot together or good unaffected leg and opposite crutch together.
Okay. So just remember the number 2-point. Duha ka moves. 2-point, duha ka moves na siya. Okay? So let's just say my right foot is injured. So I'm going to forward together the left crutch and the right foot. Abantis na dungan. Okay? Next is the right crutch and the left foot together. Together. So 2 ka moves. 1, 2. 1, 2. Ulit ko sa uyan na. Excited. Okay. So dalawa. Okay. 4-point. 1, 2, 3, 4. 1, 2, 3, 4. 2-point. 1, 2, 1, 2. Gets in you? Okay. Now the advantage of using 2-point, it's much more faster than 4-point. Diba? It's much more faster than 4-point. But the problem is that it's really difficult to learn. Medyo libog gamay si 2-point. Together. Pero malipat ko sa si patient when using 1. Mas okay man ang 4-point, hindi man malibog si patient. 1, 2, 3, 4. Pero kung 2-point eh, masabay kayo maana masabay niya maana niya na. Next, okay. So another walking pattern is the 3-point crutch gait is here. Okay? It's different from 2-point and 4-point because the injury of your patient, or it is indicated for patients with pain. One of the legs are in pain, or fracture ang usa ka leg, or amputated, or sabi pasabot na amputated, putol ang usa ka tiil ni patient na. Meaning, one of the legs is nakasaka. Gets inyo? Especially for women, you are very prone, or athletes as well, very prone to injuries sa inyong tiil, like wearing high heels, no? Pero matakil po, okay? Kung matakil po yung kilon sa may tabo, after pila ka hours, or the next day, ubag, okay? Matunog ba ninyo sa floor? Okay? So that is 3-point crutch gait. Why? Because there's only 3-point sa floor. One is the left crutch, the other one is the right crutch, and your one foot is here. That's why we term it as 3-point crutch gait is here. Okay? Okay, so can you read the walking pattern for 3-point?
Move both crutches and the weaker affected lower limb forward.
Okay.
Bear all your weight down through the crutches.
Okay.
Move stronger or an affected limb forward. Complete the walking pattern.
Okay, very good. Okay. Now, or to simplify this one, this is how a patient walks using 3-point crutch there. So first is we are going to advance or forward both crutches together with your injured leg. Yeah. So dungan as the forward. Okay. Then next is bear all your weight dirigid sa hand grip. Okay. Mangusog itang maayo dire because we will carry our body. Okay. Now you have to remember this one. When a patient walk using axillary crutch, especially 3-point, di na sila mo mag-left. Di na sila okay. They're actually using their upper extremities to carry their body na siya. So how do they walk? So, kung namin sa mga
Strong triceps.
okay. Lakaw kita. Ha?
Pero yung gihap sila, 1 to, gihap sila, 1.
Wala na, 3-point na. Wala na ito, ano ito. Ginamita yung hey! Important po, 1, 2, 3, 1, 2, 3. Don't pwede 4-point. Okay? So again, you have to carry your bodies. The reason why nga si hand grip, ako makita, the reason why nga si hand grip is at your wrist level. So that when you hold your hand grip, naka-angle ang inyong elbow up to 30 degrees na siya. So that inig-bear ni mo sa imong weight or inig-alsa sa iyong body, makahunak ang imong elbow. That's the reason why nanonood siya sa wrist level. Okay? That's you. So when they walk, so forward, outside. Forward. Ha? Labot, ikuto. Hindi na ba sa ako batiin? Walk over ako. Yes, that is for the 3-point crutch gait. Yeah, okay, very easy again. And it's the most common walking pattern ninyo makita. Okay, for patients with injured leg or kind of amputated, 3-point crutch gait is the most common walking pattern.
Pas.
Yes, pas. Yeah. Okay. Now, for the 3-point crutch gait, we also have to determine what are the weight bearings of your injured leg. When we say weight bearing, currently our legs is carrying our body. It's bearing the weight of our body na siya. But if one leg is injured, ganun na sila. Okay? So, dili na siya kaalsa sa imong body. Because if you put your injured leg on the floor, masakit. Diba? Meaning, wala na siya nag-alsa sa ito. Lawas, ato gina siya ibutan sa air. And that is what we call non-weight bearing. Okay? When we say non-weight bearing, your injured leg should not permit to touch the floor na siya. Or it should be raised in the air na siya. So the 3-point crutch gait with non-weight bearing, that is the most common. Moni lima kita permit. Kana siya na alsa sila sa tiil. Okay? However, there are different types of weight bearing there. Another one is we have toe touch weight bearing. Some of your patients or some of the clients will actually complain na, sir, kung magsigimig yung unani ba, let's just say takip po or in pain na niya till, sir, magsigimig yung unani, masakit pa, okay, is there anything at least mo na makarelax na until during the walking patterns? So you can actually recommend using toe touch or touch down. But the most common is the toe touch na siya. What do we do? So when the patient forwards together siya crutches, ang iyang toe is i-touch sa floor. That's new. But you have to remember this one. Tingnan gini mo patient, do not put any pressure or weight in your injured leg. Okay? Just imagine if naiitlog niya sa ubos, tulog pa na niya, hindi na mabuha. Meaning, nagtukod na siya. Okay? Just to relax siya. Eventually, kapuyan pa na sila na magsiklot na wala ear. So, they can use the toe touch. Nagawa na nila na. Tukod ra. Okay? So, imagine na ang itlog ni Kinit diya. Tulog ninyo. Next is we have partial weight bearing. When we say partial weight bearing, the injured leg cannot touch the floor and even carry the body of the patient up to 50% ang iyang alsa. So medyo okay na yan tail, pero there's still slight pain na niya. But bearable na siya. Or the patient can now carry sa iyang weight up to 50% Yeah. So how does a patient walk using partial weight bearing? So forward both crutches is here. The inyong tail can now touch on the floor, but yung knees is bended lang. Ingna na siya na i-bend lang yung knees, sir, because if you straight your knees, this is already 100% na nag-alsa ka sa kulawas. But if naka-bend ka, that's up to 50% na na siya. Then forward your good leg. Ano na siya? Okay? Gets in you? That is partial weight bearing. And when we say full weight bearing, your injured leg can now fully bear weight sa imo ang body, but you still need assistive device for balancing na siya. So the patient will just walk like a normal person na siya, but nakagyan po ning duha. Okay, so how do they walk? So forward both crutches together with your injured leg. This is full weight bearing. Gets in you? Normal ang iyang walking, but still needs assistive devices na siya. So balik ko na po tanan. Non-weight bearing. Okay. Then we will go with don't touch with weight bearing na siya. Okay. Then we have partial weight bearing. Okay. Then we have full weight bearing na siya. Okay. Have you saw the difference?
Wala na gamit ang latches.
Ha?
Wala na gamit ang latches.
You still need balancing. Kabantay mo na, let's just say, fractured na tail. Napapay sila yung mga clusters, I forget the term. Kaya gisiminto ba? Although they can put their foot on the floor, but because of that, di sila kabalance mo. That's why it needs a assistive device. But full weight bearing na siya.
So may mo suggest ano sa
PT and physicians.
pwede siya
Oh,
makalakad.
pwede mo bukbuk ang caregiver. Uy, caregiver, it's not your role to choose kung siya gamiton na kung ayaw mo pagbukbuk. It's the job of the physician and the PT.
Kaya ko labaw mo.
Ano sa labaw mo? Sa labaw mo? Alright, okay. Now let's talk about swing to and swing through. Swing to and swing through can be applied in 3.4. What if both of your feet is injured but you can bear weight both of your feet? Problema lang is injured lang isa na doa. So how does a patient walk? Using swing to and swing through. Okay? Ang first walking pattern katulad ng patient if both legs are injured is the swing to. Swing to sa iyang unahon para ma-familiarize niya pag-balance on how to use the assistive device, the crutches, the axillary crutch. Okay? So how do they walk? So both crutches move forward na siya. Next one is both feet will be moved na siya. But kutob na siya din sa crutch tips or crutch level lang. Gets niyo? So dili siya mo lapas. Okay? So yun siya mo. If both legs are injured na siya. Swing to.
Yes.
Because they have a kutob sa crutch tips. But if the patient is already familiar with walking using the axillary crutch and both feet are kanang injured na siya, then pwede na siya mo swing through. Okay? Lapas na si swing through.
Dua lang.
Mura siya kadua-dua. If the patient is using 3-point crutch gait, pwede po siya mo gamit sa swing to o swing through. If the patient is pag-ula siya nakakat-on o how to kanyang auxiliary crutch, to swing to sa to itudlo niya. Which means that the good leg should level sa crutch tips. Sabi ka ko na niya, puto na dali.
Mas easy ang work.
Because bago po siya nag-learn. Okay? Now, if the patient is already familiar with the walking pattern, then mag-swing through na siya na 3-point. Lapas na. Kung familiar na siya sa walking
Ang
pattern.
swing to sa dili lapas.
Dili lapas. Kutob na sa crutch
Ang
tip.
swing through.
Only lapas. Through. The word through, lapas walking is there. Gets in you? So those are the common walking patterns using the axillary crutches there. Okay? So by the way, this is what we call the forgot. This one is called elbow crutch, or also known as forearm, or also known as loop strap crutch is here. Okay? This is commonly used for patients who are walking using 4-point and 2-point na siya. Okay? So if ever any the elderly client is using this one, yung 2-point, very easy na kayo. So move together your left crutch and your right foot. Okay? And then your right crutch and your left foot. So do it. So 1, 2, 1, 2. Ikaw na maglakaw si patient using the 2-point. But if 4-point na siya, so 1, 2, 3, 4, 1, 2, 3,
Use height adjustment.
Nagay pa height adjustment.
Nakita sa mo.
Mas intro sa
Okay, kahit na rin, kita yan naman na rin.
Dili, swing na ba just?
Ay, di pwede i-swing ito naman ang buwan mo. Saan mo mag-swing ito matumba yung taon si pasyente. It's only used for 2-point o 4-point na. 2-point and 4-point na rin. Di pwede ka na 3-point na rin. Kailangan na matumba yung taon mo, maluhay mo sa pasyente. Okay? Yes,
Sana
niya?
ko naman, may ka-level sa imong kwan.
Wala may kwan sa kwan. Okay? Alright, so, ganun is, okay na video, practice sa mukha.